trilateral meeting between the US, EU and Japan and their new joint statement on so-called non-market-oriented policies and practices of third countries. What's the latest in the US-China trade war? And the global fight against tuberculosis is attracting fresh attention. World leaders at the UN General Assembly meeting announced their commitment to tackling TB. But how can leaders transform big talk into real results? Welcome to The Point, live from Beijing. I'm Li Xin. While Washington and Beijing are locked in escalating trade frictions, the U.S. appears to be speeding up its coordination with allies such as the EU and Japan in so-called addressing non-market-oriented policies and practices of third countries. After a trilateral meeting on Tuesday in New York, trade ministers from the U.S., Japan and EU released a joint statement on, among other things, the need to reform the World Trade Organization to guarantee so-called proper functioning of the international trade. Not mentioning anybody by name, the statement accused so-called third countries of conducting so-called unfair trade practices, forced technology transfer and subsidies on state-owned enterprises. With the trade spat going on among the EU, US and Japan, will they be able to overcome their own differences? What would this statement, if translated into policy, mean for China? Welcome to this discussion, and my guests are Harvey Zoding, Senior Research Fellow at the Center for China and Globalization, and Zhao Hai, Research Fellow at the Chinese Academy of Social Sciences. Gentlemen, welcome to the show. So let me give you a little bit more details about this joint statement, which was released on 25th of September in New York by Hiroshige Seko, the Minister of Economy, Trade and Industry of Japan, Ambassador Robert E. Lighthizer, the U.S. Trade Representative, and Cecilia Malmstrom, the EU Commissioner for Trade. Now, the joint statement actually consists of 6 separate statements on concerns with the non-market-oriented policies and practices of their countries, on industrial subsidies and state-owned enterprises, on concerns of forced technology transfer policies and practices, on discussions on WTO reforms, on digital trade and e-commerce, and on cooperations on other issues. The joint do not mention China anywhere, but you can see China printed all over the paper. Let me go to Mr. Zodin here. What do you think is the purpose of this paper? What's behind it?
I think the purpose of the paper is to put more pressure on China. President Trump is ramping up the trade war, and so not content to deal just with tariffs, he's going through the WTO, an organization that he hates, which he said is an absolute disaster. And I think that this concerted action by the 3 entities is designed just to put pressure on China.
Okay. Mr. Zhao, the wording of the statement, of this joint statement, sounds actually very familiar. Sounds a lot like the terms that we have been hearing from the United States among its accusations against China. How come? What could have been the possibilities?
Well, first of all, a little bit of history here. The trilateral meeting started not just now, but actually you can trace it back to December 2017. The 3 parties started meeting, and now this is actually the 4th meeting. And this is the one statement, joint statement they published, and detailed what they're going to do against essentially China. And what they have been doing, or what they have been complaining from EU, Japan, and also United States continuously for the past couple of years has not changed. And I think in the past administration, for instance, Obama's administration, they're trying to create alternative trade pacts with other countries and try to elevate the standards so that exclude China from for instance, TPP or TTIP. And this administration is threatening WTO to quit WTO, and ultimately they want to come back and reform or change WTO using the items you mentioned in that joint statement, trying to pressure China to change its behavior, or otherwise to design a mechanism that can supervise or limit China's reach in that upgraded WTO system.
How much do you think this is empty talk, and how much do you think it's carrying real weight, Mr. Zhao, still to you? Because we know actually the three of them have a lot of differences among themselves as well. You mentioned the TPP, the United States, the latest president, Donald Trump. The first thing he did after he assumed office was to withdraw from this pact, and to the chagrin of Japan, for instance, and they're yet to resolve this difference.
Yeah, I think there's apparent difference between EU, Japan, and the U.S. position, because on the one hand, actually EU and Japan is putting one foot in the U.S. boat and putting another in the Chinese boat. They wanted to take advantage of both and avoid the downside from the both. So I think on the one hand, EU and Japan also in the trade friction with the United States in terms of auto and agriculture and a lot of different areas. On the other hand, they wanted to cooperate with China defending world free trade open system against American protectionism. So they have complicated positions in this respect. In terms of this joint statement, interestingly, they didn't mention reciprocity, which is the American word. So I think this document is kind of a compromise. In the document, they talk about fair trade and also mutually beneficial arrangement between the countries, and particularly within the WTO system. So that is actually, I think, EU and Japan's effort trying to bring the U.S. back into multilateral mechanism so that they can work together.
So, Mr. Zodin, what do you... If you have any comments, you're welcome to add here. And also, I want to really comment on one of the things that was mentioned in the paper, which is the so-called subsidy, third-party subsidy on state-owned enterprises. Let's be frank that the US, EU, and Japan are one of the heaviest subsidizers of the agricultural sector, for instance. So, who gave them the right to point finger at a third party who are doing very similar things? And by the way, subsidies are not totally banned by the WTO. There are subsidies which are allowed under WTO rules, and there are subsidies which can be argued under WTO rules. So you cannot say, so long as it is subsidies, all bad.
I think if we look at the issue, and this calls for an example from the Bible, and that is, let he without sin cast the first stone. So all the parties are guilty to some extent here, and so that, I think, has to be factored in when you consider these issues.
And also in terms of the so-called forced technology transfer for market entry. I mean, we've heard this topic in the news again and again. China has said there are no forced technology transfer. These are contract-based behavior where people sit down and agree to the terms that they're signing up to. Who has the legitimacy to decide who is right, who is wrong? I mean, does the United States, the US, and the EU and Japan have the right to say, China, you did the wrong thing? Does China have the right to say, you know, who has the final judgment here?
Sorry, but I think that China does say that, but Premier Li said during the two sessions that China was going to end this practice. So if you're going to end a practice, it means that the practice existed. So I don't think China can deny it. I think that this could be worked out on a multilateral basis, and it has to be. I think one thing that's holding China back in the eyes of the world is that China does engage in some problematic trade practices, protectionist practices, and IP transfer problems, and if they can clear the decks on that, I think then we can have a more meaningful discussion on the other important issues.
Well, I think, by the way, you don't have to be sorry to disagree with me. Secondly, I don't think that you know, there are certain you have to do something before we can engage meaningfully. Dr. Zhao, Mr. Zhao, what is your take here? I mean, I think that kind of expectation is going to be unacceptable for China.
Yeah, well, first of all, about forced technology transfer, there is some historical behavior, and if you look at the American published report on Section 301, they used historical materials from back half a dozen years ago. Some of those behaviors are probably true, and China has moved on and improved intellectual property protection and improved its system since then. And China's own economy, own companies are trying to innovate and trying to protect its own intellectual property. So I think in that respect, China is moving forward, and there's area that U.S. and China and also other parties can agree upon. So I think that's an opportunity and concerns we can address. But in terms of U.S.-China trade war currently, I think it's a long-term friction, and so far there's no easy solution. So I think both parties are waiting out for the other parties to move first, and particularly on the Chinese side, it's hard to believe what the U.S. is saying or doing now, because they reverse back and forth. There's no consistency in terms of policy from the White House.
Right. Well, one of the things that really surprises from this latest joint statement is that the United States seems to be interested in reforming the WTO. I mean, this is quite different from the displeasure, let's say the least, by the Trump presidency of the World Trade Organization, which has been made very public. So, Mr. Zodin, what do you think of that? Now that he talks about reforming the WTO, how much credibility can we give to that?
I mean, I think it depends on what happens in the future, but I do think that it is the silver lining in this dispute, because they are willing to go to the WTO. The WTO has 164 members, and they reach decisions by consensus. We know how difficult it is to reach a decision by consensus, even when you're dealing with a few nations. So I think it's going to be very difficult, even though you have powerful entities here. But I think at least that they went to the WTO as opposed to taking tripartite action on their own. So I think it's a step in the right direction, and for the Trump administration, a little surprising, actually.
Yeah, and also from the EU part, actually, just 2 months ago, the EU's, the same trade commissioner was talking about an agreement that the EU reached with China on reforming the WTO. According to the Euronews, it was seen to be sending a message to the United States by establishing a common front in the protectionist trade wars unleashed by Trump. And the same trade commissioner was quoted as saying that China has made strong pleas to keep markets open and fight protectionism. And she also said that this is assuring to the EU and its business community. Now that they're also standing by the United States and Japan and accusing China of all of these things in the joint statement. Mr. Zhao, have we seen the EU swinging back and forth on this issue?
Well, as I said just now, I think these two positions are not incompatible. Actually, on the one hand, EU has a strong interest in maintaining multilateral free trade open system. And in that respect, EU and China share the same interest. That's why I think EU wanted to stand with China against U.S. rising protectionism. On the other hand, EU has another interest in terms of maintaining market-based, rules-based system as well. So I think they wanted to work with the U.S. on that front. Overall, I think EU is very strong in have a very good sort of strong interest in maintaining the current system and improve the current system. So I think China and EU can work better. And there's a lot of unresolved problems still between the EU and the United States. We have to look at the meetings in November and whether or not this trilateral meeting can really produce anything in the following meetings. Okay,
we have to leave it there. Many thanks to my two guests, Harvey Zoding, Senior Research Fellow at the Center for China and Globalization, and Zhao Hai, Research Fellow at the Chinese Academy of Social Sciences. You have been watching The Point with me, Li Xin. We'll take a short break, and when I come back, the UN General Assembly took a look at the threat of TB on Wednesday. What steps are needed to fight the infectious disease, and what commitments were made? Stay right here. China's First Lady, Professor Peng Liyuan, delivered a speech to the United Nations General Assembly's high-level meeting on the fight to end TB on Wednesday. As the World Health Organization's Goodwill Ambassador for TB and HIV/AIDS, Professor Peng talked about China's experience in combating TB and the Chinese government's efforts to prevent and cure the infectious disease. Now, TB is the world's deadliest infectious disease. In 2017, the WHO recorded a total total of 10 million new cases of TB and 1.6 million cases of people who died from the disease. At Wednesday's meeting, world leaders committed to ensure that 40 million people with TB receive the care they need by the end of 2022 and to provide 30 million people with preventative treatment. So what needs to happen to realize these ambitious goals? What has been China's experience in fighting the disease? Joining me for the discussion are Han Hua, Research Fellow of the Chongyang Institute for Financial Studies of Renmin University of China, and from Paris, Dr. Eric Ding, an epidemiologist, nutritionist and health economist, and currently a visiting scientist at the Harvard Chan School of Public Health. Welcome to both of you. Ms. Han, let me go to you. TB has been described as a vicious epidemic, fueled by poverty, inequality, migration, conflict. It's been a big problem for a while, especially for developing countries. But this is the first time that the General Assembly of the UN has focused on this disease. Why? Why now?
Yes, Shane, as you have already pointed out, TB is the deadliest world infectious disease. Infectious disease does not have any borders. So it is a global challenge which needs a global efforts, global partnership, and a global solution which is an optimized one that can benefit most people. So I think the UN General Assembly is one of the most suitable stage that people, especially the leaders from the countries, can gather together, address this issue, and work out a workable plan to put their political commitment as well as their capital investment or talents commitment as well as their other efforts together. And we also have Professor Peng as well as other goodwill ambassadors of TB so that they can help raise the awareness of the TB severity so that people can work together to find the cure ways.
Right. Dr. Ding, the meeting concluded with an adoption of an ambitious political declaration on TB endorsed by heads of state. Among other commitments, the declaration says that world leaders have reaffirmed the 2030 Agenda for Sustainable Development, including the resolve to end TB epidemic by 2030. How far are we at this moment around the world in terms of fighting TB?
Well, TB is historically one of the most infectious and deadly bacteria, because you have to think 1 in 2 people worldwide actually have been exposed to TB, and 1 in 4 people, 1.7 billion people, actually have latent TB. So 1 in 4 people worldwide walking around with TB inside of their bodies. And this epidemic trounces all other epidemics, and the mortality of it is incredibly high, but it's also incredibly treatable and preventable. But the key is that up till now there has not been a very effective vaccine. But just this week on Tuesday in New England Journal of Medicine they published a brand new TB vaccine in phase 2, the M72 vaccine, that actually in healthy HIV negative people actually reduces TB by 50%. So prevents 50% of all TB, and that's very, very promising. So phase 2 is very close to potential reaching the market, and I think for the first time in over 2 generations we'll actually have a real effective TB vaccine. But then that's just the tip of the iceberg. So much of TB is untreated. You mentioned 10 million people have TB a year, but there's actually 3 million people who have undiagnosed. 1/3 of all TB is undiagnosed. So you know, detection, treatment, prevention, all important.
Sure. It's good news, by the way, to hear about the latest vaccine progress. Now, heads of state and government attending the meeting, they also made a lot of pledges on the funding side. For instance, they agreed to mobilize $13 billion a year by 2022 to implement TB prevention and care, and an additional $2 billion for research. They also committed to taking firmer actions against drug-resistant forms of TB and build accountability and prioritize human rights issues such as stigma that still prevents TB from being properly combated around the world. So, Ms. Han, what difference do you think this latest round of pledge of funding will make?
Take China as an
example. I
example.
think the funding is...
Okay, sorry, this question is for Ms. Han.
Sure. Take China as an example. We can see the status quo now is that China is still the #2 country next to India to have the most TB cases in the world. And this is the status quo now. And China has already committed, as some other governments, to commitment in terms of realize the SDG goal with UN by 2035. So between this, there is a big gap. If we can get, I hope it can be proportionate because of the TB cases among the world, the developing countries. By the way, these TB cases also shows that China is still a developing country. So that the fundings as well as the resources allocated with the fundings, like I just said, the talents, the other resources, including the measures and the means to take over TB, especially the drug resistance causes, can be very significant.
Dr. Din, it's a lot of money we're talking about. Why is TB prevention and treatment so expensive, and is there a lack of political will there?
It's expensive because the treatment is not a single pill, and the treatment basically is a very long course, over 2 years sometimes, 6 months to 2 years of very intense drugs. And pharmaceutical companies, by the way, for example, Daraprim, 2 years ago, there was a temporary 5,000% increase in the cost of this drug. Luckily, it came back down, but these costs of these drugs are very difficult. And the testing oftentimes in developing countries, remember most of TB, 97% are lower and middle income countries, requires electricity and very intensive sputum tests. And a lot of these tests, there's new tests that are, like LAMB that doesn't require it, but these tests are really intensive, the treatment's very intensive, and if you have multi-drug resistant, the amount of hospitalization that's required is incredible.
Yeah.
So, but you have to think, this is a world disease. So Donald Trump's view of each country to his own is completely asinine, because you have to think, TB can transmit across the world very quickly on airplanes, very quickly between countries, and so we have to unite as a country, as a world, in treating this. And unless you stamp it out in every single country all at the same time, you're basically going to play whack-a-mole, as in once you stop it in one country, you keep popping up another.
It comes up somewhere else. Basically, patriotism alone will not fight TB here. That was kind of, yeah. But let's look at what China has been doing. I mean, China has one of the heaviest burden of TB. According to the WHO, China has an estimated 1 million new cases of TB every year. That's more than any other country except India. So, Ms. Han, what kind of progress has China made in terms of mortality and incidence rate, and what has made it possible for China to make these impacts?
From an observer's perspective, I would see the progress so far China has made can be regarded as stage 1 in terms of fighting against TB, because we have lowered the mortality rates significantly. But still, as Dr. Ding pointed out, TB is such an infectious disease that can be easily transferred on an airplane, in the working, learning, or whatever environment. So it can be easily transferred, the infections. So we still have a long way to go as long as there is no effective vaccine to be produced. For example, TB is called a disease of poverty. We have a lot of cases happening in the rural areas, and the patients need to take a time of span like from 6 months to 2 years of taking the drugs, medicines. But it's on a very regular and scientific basis, but the rural people, they don't have this kind of time or the other conditions, resources to do this. So we need doctors to help them with that, or even supervise them with taking the medicines. So I call it a stage 2, or a longer term stage of fighting against TB in many ways. This is just one way, and there are many other means needs to do, such as we need to also lower the rate of incidence rate, and we need to help people to raise more awareness of this TB disease.
Okay. Basically, in 2010, China achieved the TB control target of the UN's Millennium Development Goals, which is 5 years ahead of the target. This means that over the past 20 years, China has reduced TB prevalence and mortality rates by half. Dr. Din, what have been China's distinct burdens in fighting TB? According to your observation, any experience that can be benefiting to other economies fighting this disease?
Yeah, China's done a really good job in terms of reducing the incidence and mortality overall, but there's still high levels of inequality. There's cities that are wealthier, medical facilities more available and easier to detect, but again, this is a disease of a lot of poverty. And so it's not just health services, which is really important, but also your buildings need to have really, really good ventilation to prevent transmission. Because preventing transmission is absolutely just as critical as these treatments.
Okay.
Again, or else you'll always be playing whack-a-mole.
Yeah. Well, I have to apologize that the sound level is not very good coming from Paris. But anyway, Ms. Han, my final question. What do you think can be some of the experience that can be shared by other countries?
I think it's a two-way street. From China's perspective, Chinese government is still moving forward towards including the TB cure, the payment of the TB cure into the national health care system. I think it's a very good step if it can be realized. So probably the other countries can also taking this measure into consideration. From the patients and doctors' perspective, I heard some NGOs, paying more efforts in terms of using the modern technologies, for example, the medicine box, to help supervise patients taking the regular medicines to cure TB. This can be also shared without the borders.
Okay. Many thanks to my two guests, Han Hua, Research Fellow of Chongyang Institute for Financial Studies of the Renmin University of China, and in Paris, Dr. Eric Ding, an epidemiologist, nutritionist, and health economist, and currently a visiting scientist at the Harvard Chan School of Public Health. And that is it for this edition of The Point with me, Li Xin. As always, you can follow me on Facebook and Twitter using the handle The Point with LA. Download the application called CGTN to watch the show on your mobile devices, or go to YouTube and look for CGTN The Point. Thanks for watching. Bye for now.